Calvin, my son, who is 15, got his red card after we discovered that he had femoral retroversion and that he was in a great deal of pain. He was hitting his legs and biting until he broke the skin, and we kept being told it's behavioral, it's just a behavior. We took him to the doctor over and over, and they said he's just behavioral. And we said, well, he's in an ABA therapy center getting behavior therapy, so I don't know, really what else we can do. We're in the top-notch center that they have here, so we dealt with it, and finally, we found a chiropractor that said you need to go see this orthopedic surgeon who evaluated Calvin and said that, Calvin has a long road ahead of him, to get all of this straightened out. And that after, evaluating him and observing and checking everything out, that he did believe that Calvin was in a significant amount of pain. Well, first he was on Tylenol 3 and another pain pill that worked for like 3 days. And after the third day, it was like he was hitting again and biting. And the oxycodone seemed to help with pain, but it made him very uncomfortable. He cried, he would whisper, and he still wasn't sleeping. It's not uncommon for Calvin to go 2 days with no sleep. So that's how we obtained a red card for him, was because he had pain, which really is a shame that he qualifies for pain. But before the pain, running around, beating his head until it bled, biting himself, puncturing his skin. I mean, I've shown you guys pictures. Horrible, horrible self-injurious behavior. He was super aggressive. He wasn't sleeping. He was taking off at night, and we backed to a 4-lane road. The whole thing was just really dangerous. And, for autism not to be considered a life-debilitating condition is beyond me. He was sleeping through the night. It was just so nice to be able to rest and get sleep. And he clearly wasn't in pain anymore. He would hit the insides of his legs, so he was constantly bruised here. And he would hit his hips. And when he was in pain or something was going on and having an episode, he would clip the side of the couch, the frame here, while he was running, and wouldn't even faze him. The pain from hitting it so hard that there was a bruise this big would not even faze him. Conservative estimate would be 2 hours a day of restraining him. We had a spot in the basement where he had no access to any walls. We're holding him down, and we're getting hurt. And he's escaping from us and getting hurt and putting his head through the wall and biting himself and flooding the house. And he flooded the house 60 times, plus, at least 60 times, from December of 2012 to December of 2013. Constant. His anxiety was so bad, he just flushed anything that made him feel nervous.
Yes, but
no matter what it was.
Cannabis has definitely brought a lot of that down for us.
Oh, absolutely.
Oh, night and day.
Big change. Big change.
We wouldn't want to even wake up.
Well, when we started with Calvin, the day that he was legal, I went to a dispensary and I bought him an edible. And it was a 70 milligram edible. It was indica edible. And I cut it up into 8 pieces, and I gave it to him. And an hour later, he started he was watching Elmo and Grouchland on TV, which he's seen literally a million times. And he started saying the words that they were saying while they were saying it. And we were looking at each other.
He's nonverbal. He doesn't speak. He maybe had 5 words at one point, and he's able to identify things. And he talks through a augmentative device, basically an iPad that has vocabulary inputted into it. And that's how he really spoke to us. And he'd pick up on some words from using that device through his autistic center there that he's going to. But the drastic change that we saw with his vocabulary was really an eye-opener. We were just amazed.
It was
And
immediate.
it's still.
Which Dr. Seuss book do you like? Dr. Seuss's
ABCs.
ABCs, yep. Big A, little A.
What is that? A?
What begins with A? That's right. What begins with A? Ant, Annie's, alligator, A. The first dose, he was saying things, simultaneously with the movie, and we were just so happy. And we're 6.5 months into treatment, and now what we're seeing as this, has progressed is that we'll be having a conversation, and he won't be engaged in our conversation at all. He's not looking at us. Yeah. He's not interested. And if you were to look at him, he looks totally, completely zoned into what he's doing, like he has no idea what you're discussing. But if we say birthday or Costco or natural grocer, now he looks up and says natural grocer or Costco.
Yeah, it was almost, for a while we were, we talk amongst each other and we have no problem. All of a sudden now we got to watch what we're saying because he's tuning in.
And he hasn't been incontinent since cannabis oil. Wow. He was incontinent at least once a day at therapy. We'd pick him up and he'd be holding a plastic bag with the clothes that he had an accident in. It was a green hornet. It was an indica. We cut it into 8 pieces, and that was the night that Calvin was saying the words with the movie. But after he said the words with the movie, he laughed so hard that it was hard for him to catch his breath. I mean, you could just tell that he felt better. And, autism is weird because it is a neurological disorder, but it doesn't get treated like an illness. It just gets treated like a behavior issue, and no one wants to deal with you. People don't come over and bring chocolates and dinners or whatever when your kid gets diagnosed with autism. They stay away from you. We don't know a single family who doesn't have an issue with someone in their immediate family because of the way that they've treated their autistic child. It's just a totally different ballgame when you're talking about autism. It's not seen as an illness. There really isn't compassion. And I believe that Calvin has the right to live pain-free, to be happy, to be comfortable, to not have anxiety so bad that he's putting his head through the wall or biting himself until we have to take him to the emergency room. It's like, what we want is very simple. We just want him to have the same shot that other kids have. We want him to be able to be a kid and to sleep and to have peace and to be calm and to feel good. Are you happy? Did you open the video? Calvin, did you open the video?
Yeah.
Look. Did you open it?